And if you're coming in, I'm going to go ahead and raise the bed. And then while I'm talking to her, I can go ahead and clean my hands or wash my hands. It's always reassuring to the patient to see you do this before you touch them. Okay? So, Mrs. Anderson, good morning. You know you're going down for surgery in an hour, hour and a half? Yes. And by the way, when we do our pass-offs, I'll be the patient. And I'll say things like, why do you have to do that? Okay. Now, because you're going to be on the surgical table, we need to be sure that we don't have any urine on the table, because then it's obviously not sterile anymore. So we're going to put a catheter into you to collect urine while you're on the table. Generally, if they're going in for surgery, they've had an enema the night before, too. Such lovely things we get to do to our patients. Okay?
Is it going to hurt? Is it going to hurt?
What? Oh, okay, you're the patient? Okay. It shouldn't hurt. You might feel some pressure, but there should be no pain. Okay. Have you ever had a catheter before? No. What is it? We're simply putting a tube in through the opening where the urine comes out, up to the bladder to collect urine while you're on the table. Well, how long does it have to stay in? Well, we don't know for sure, but we'll get it out just as quickly as we can once after the surgery. Okay? And assuming everything's normal, they get that thing out as quickly as possible, sometimes even in the recovery room before they ever hit the floor. Okay? Because if the patient comes in and gets a UTI while in the hospital, Medicare's rule is we don't pay for it after that. We don't pay for anything in connection with that health, and the hospital loses money. But that's why in some cases when they're going to admit a patient, they'll do a urinalysis before the patient ever comes in. So if they can prove the patient already had an infection when they came in, they'll still get paid. Okay? Now, what we're going to do is to go ahead and pull the covers down. Do you tend to chill easily? Yes, I do. Bath blanket over the top. Okay? Now we're going to go ahead and bring this down. We're going to leave her as covered as we can for as long as we can. But we're going to have this area clean, and we're going to have clearance here. So we're going to take this further down when we're ready. Okay? Now, do you have arthritis in your hips or anything of that sort? Why, yes, I do. Okay. You may need help for her keeping her legs open enough for you to do this. So if it's serious, you can see, can you take the position? Now, what position does she need to be in? How is it? Okay. Frog. Think frog. Knees out, feet together, like a frog. Okay? So you can check and see, can you take this position, and you want her this way and this way. So you have all the room you can in here. You may have to have her take her feet further apart when you're ready to go. So you see if she can take the position. If she can do it by herself, then we're going to wait and let her do it a little bit later. Okay? Then you're going to come in and you bring regular gloves, you bring a basin of washcloth, have some nice warm water and some soap, and you have your kit, you have your stat lock, and you have sterile gloves your size. Because again, this says there are sterile gloves in here, and all it says is that there are 2 latex-free, powder-free gloves in here. Doesn't tell you what size. And there's no consistency from kit to kit what size is in there. Some of them have large, some of them have medium, none of them have small. So this isn't that particular thing isn't real helpful to you. Bring your own. Also, because otherwise you have to reach into the kit with your bare hand to get those sterile gloves. And to me, that's a violation of the sterile kit. So you're going to have regular gloves on. And the first thing you're going to do, and one of the reasons you bring the basin is you're going to be sure she's clean to start. If the patient's been incontinent, let's get her cleaned up and the bed changed before you ever do this. Okay? So I'm just going to check and be sure that you're real clean because we don't want to cause any infection with this. Okay, yeah, no incontinence here, we're good. Okay? But you can clean her if you need to. And the next thing before you ever open the kit, are you allergic to iodine or shellfish? If she is, you're going to wash her really thoroughly. Get her as clean as you possibly can with soap and water. Okay? And then you won't use the the iodine that's in here. And then you open our chart. All right. Now, this kit gives you some information, which is useful. And it tells you, for example, what size you're using. So this is a 16 French. 14 to 18 is the size you'll use on adults normally. Okay? And 16 is pretty much what all the kids have. And it'll also tell you underneath, you have a 5 milliliter balloon which you fill with 10 milliliters in order to inflate it. So you're going to record in your charting what size you're putting in and how much you put in the balloon. So the next nurse, if she's taking it out, knows how much she should get out, so as not to try to pull the thing out with the balloon still inflated. Okay? This also, now this does not tell you whether it's an open system or closed system, but you will want to chart that. If it's an open system, you put the catheter in and the drainage tubing for the drainage bag is separate and you connect the two. If you have a closed system like in your kit here, it's pre-connected and it's taped. One less place for infection to get in. So your closed system is preferable, but there are places that only have the Foley catheter and the kit separately, or it may turn out you need to have a different size than is in the kit. So then you would have probably the separate pieces and bring them in and put them together before you put it into the patient. Okay? So we're going to get that out of the way. Yes?
Expiration date.
Thank you. Expiration date. You're always going to check the expiration date on these, and this says 11/30/22. So inserted a 16 French non-expired closed system urinary catheter, 10 milliliter balloon. That's all you need to chart. Unless there's problems, and then you're going to chart not only the problems, but what you did about it. If you have not yet read the information in that charting documentation guidelines, please do so before you chart this week, because I'm going to require everyone to chart on this procedure so that you can get some feedback next week. By the way, did you see I kind of bleed all over your papers? I'm going to give you lots of feedback, and the feedback on there may give you a starting point of some things that you can correct this week. All right, so I'm going to push my trash over here, please, Maya. Thank you. And anything here, when you're doing a sterile procedure, people, you don't want to ever drop your hand to put stuff in the trash, and it's a natural move because we do it at home to make sure we don't miss the trash bucket. I no longer have a clean hand. Okay? And if I have sterile gloves on, I no longer have a sterile glove. So get in the habit when you're doing sterile procedures and just drop it. If it misses, pick it up later. Who cares? Okay? But if you get in the habit of just always dropping things in from up here, if you miss them, pick them up. But that way you don't have to think about it when you do your sterile procedure. You're in the habit of dropping it from up here, and that's what you want. We actually, my clinical group got a chance to watch this doctor do a bone biopsy, and during the preparation for the thing, he finished, she had a little bleeding, he took sterile gauze, he kind of dabbed at the bleeding, and then he went to drop it into the trash. And every one of my 8 students went, and it went, whoosh. He had no idea what he had done, and went right on with his procedure. And when we got out of the room, one of the students said, "Did he?" And I said, "Mm-hmm." But every one of them had seen what he did. Okay, now here we get to opening the kit. And I love watching people who've only done this in 101 do this, because they're kind of, and you're so careful. Now, for her, she likes that because she wants this whole field to be sterile. The only thing I'm worried about keeping sterile is what's inside that kit. So I don't really care how you open this as long as you don't contaminate the kit. This is the only place where you're likely to contaminate the kit, so you have to grab the outside of this one and pull it back. Now, I'm still sterile, the whole thing's still sterile right now, but I'm going to make it unsterile right now because I'm going to grab it, I'm going to turn it, and I'm going to move the box. okay? But I can do this because all I'm worried about keeping sterile is what's in there. That's my sterile field. Okay, so I'm going to put this down here, touching only the outside. And even if I had sterile gloves on handling this, people, once you have this thing open, the outside of this box is considered contaminated. Anytime you touch the outside of this box, it's considered you've contaminated your gloves. Okay? Now, the only thing that you can grab without gloves or with regular gloves on is this very top piece. And this is what goes under the patient. So I'm going to grab this by a corner and I'm just going to get it out of the way. Then I'm going to open it. And you'll notice there is a very clear shiny and non-shiny side. Shiny side's down. And this is going to go under the patient. This is to keep anything from getting on the bed. So if your patient can take your position now, great. And apparently she can. Or perhaps with a little help from your friends. Okay. So because of the area you're going into, you may want gloves on. Can you do this once your sterile gloves are on? Yes. But there is a chance of contaminating your sterile gloves. The way you would do it if you had sterile gloves on, you would take, now I'm touching sterile to sterile, so I can take the thumbs on the shiny side, the fingers pointing up inside, wrap this around my gloves, and go in under her. And that way I'm protecting my gloves from being contaminated and still getting it under her. I prefer to just put it on with regular gloves and get it under her. If she can raise her butt, all the better. But all you need is for this to be in enough that if there's any dribbling, the bedding is protected. Okay? Then leave her a little dignity for as long as you can. You have already pulled the curtain to give her privacy. And I don't care if she's in a private room, if she's in a double room and the door's closed, somebody's going to walk in the middle of this. So pull the curtain, even if you're in a room with the door closed. And why is it that every time you put a mask on, your nose itches? I've never figured that out. Okay, now I'm going to put my sterile gloves on. I don't care what I do with this because I'm not using it as a sterile field. One of the things people try to do is to put on their gloves this way. Okay? And when you try to do that, inevitably as you're opening, you bring the flap up and over the kit and you have now contaminated the kit. So don't be afraid when you are doing this, people. You remember with the sterile field, you keep facing the sterile field? Do you remember that from 101? Okay. All you need to do, or from what she taught you last week, I'm going to take these gloves out, and I'm simply going to move my body. It's okay to move your body around the table. Okay? Dry hands thoroughly prior to donning. They're not kidding. Try to put it on right after you put that stuff on to clean your hands. Getting them on is a dickens. Okay, so I'm going to grab it by here. I'm going to open it. Now you can keep this open in various ways. You can do this and it may work, it may be enough. You can do the catacornered where you make a little bit of a wrinkle and fold it down, that'll hold it open. You can take it like this and kind of roll it over the edge to help keep it open, whatever you need to do so it stays open while you're working. Now, do I put on my dominant or non-dominant glove first?
Non-dominant?
The answer is yes. I put on my dominant or my non-dominant glove first. It doesn't matter. They used to always teach us dominant hand first until somebody finally said why, and no one could give them a reason. Because there isn't any. It doesn't matter which one you put on first. Okay? So if I reach for my glove, you see how I come over the other glove to get it and contaminate the other glove? Move your body. Grab your first glove. Lift it up. Get your fingers in. Step back from the table so that you're not risking contamination of the other glove as you put this one on. And of course it's not going to cooperate. Okay, here we go. And your glove goes on. All right. Now, the glove should fit tightly enough that you have no glove sticking out beyond the end of your finger. Because if you do, it's easy to touch that against something and contaminate your glove and not realize you have because your finger didn't feel it. It only touched the glove. The next thing is to put this one on. How do I come into it?
Under the sterile cuff.
Scoop under the cuff. When I do that and I try to come in this way, it's easy to push this onto the outer edge. One of the ways you can prevent that is by grabbing the thing, turning it. Now I have, if it scoots, I don't care. Okay, so I'm teaching you things I learned the hard way. So you're going to get your fingers under there. Lift it up, get your thumb out of the way. You're going to pull only with your fingers. Fingers in. Thumb in. Pull. Keep pulling. Touch only the outside of the glove with your sterile glove. One of the things, again, to watch here, the tendency is to want to pull here. This glove's now contaminated. Pull down rather than trying to pull up. Okay? And then I can go into this one and pull it down further. Okay? This, don't need, bow. Okay? I don't care if it lands on the floor, I'll get it later. Okay? Be sure that all the fingers are down. And I'm ready to start. Now you do all your preparations before she has to take the position, because this isn't a real comfortable position for most people. Okay, so I'm going to get rid of these gloves because I'm not using them. I'm going to get rid of this because she's not at all shy. She's had 47 children.
Oh.
And by the way, notice on the board, see that nice row of little dots on the board? That's your textbook picture of what you're going to be looking at. Clitoris, meatus, vagina, anus. Nice straight row. All you have to do is go for the second from the top. In your dreams. Now we have a 350-pound, 47-year-old woman who's had 8 children. That meatus could be anywhere. Meatuses migrate with obesity and with childbirth. Surgeries can make it move. The toughest one I ever found was almost an inch into the vagina. And try finding that one. I used to be called the queen of the Foleys on the floor. It wasn't a title that I particularly wanted. Okay, so you can move the table in if you need to. Okay, so that you're close and looking.
And it's stuck.
Yeah, okay.
The wheel.
Is it on something? Okay.
There you go.
Okay, thank you. You can move it back and forth with your foot. I'm not quite ready to do that yet, but I'm going to pull it back out a little bit. Now, I'm going to take the top off. If I handle the outside, contaminate the glove. So I'm going to handle it from inside, and I'm actually going to turn this thing around. Should have done this before. I can work with it this way. Okay. So I'm going to need to grab it by the inside in order to lift it and bring it. And your safest way to do this so as not to contaminate, bring it out and then back into your field. If I do this, my arm comes over that, and that's contaminated. And one of the main things you're going to hear me saying as you do this is arm, and I want you to look where your arm is, because that's most likely where you're contaminated. So I'm going to bring this out, bring it around, bring it back in, okay? And I'm going to do my preparation here. I've got my betadine. I've got my little pincher that I'm going to hold the cotton with, and I've got 5 cotton balls. And you may have the kit like in that straight calf kit where you just have the wrapper with 3 iodine swabs in it, big fat swabs. So I'm going to separate these out so that I can get them when I pick them up and I don't get 2 at a time. I'm going to open this and I'm going to spread this on the cotton balls. Then this must be kept. You can't throw this out until you're done with the procedure. Anytime you're doing any procedure, anything you're cleaning with or using in the procedure must be kept with the label up so that anyone coming in can see what you're using. And that's a Joint Commission rule. Okay? Then I'm going to put this back because I'm not ready for it yet. You'll notice there's a specimen cup in here in case the doctor says put a Foley in and get a specimen and send to the lab. There is this, which is your sterile water for inflating your balloon. And there is this, which is your gel for lubrication. all right? The Sterilube. Are we using this? Okay. Unfortunately, we have a spray lubricant, which we're supposed to use for the mannequins, and it doesn't allow the things to go in. So we're actually using the lubricant. Use as little as you can get by with, but use the lubricant. For a female, if you look on that week 7 preparation for Foley catheters, you'll see for a female you're going to lubricate about 2 to 3 inches. For a male it's considerably more because the bladder's further up, plus you have to go through the penis. Okay? So we're going to take this off and we're going to put some lubricant into that area. And I only need 2 or 3 inches, so I only need to put in 2 or 3 inches, and then I'm done. Okay, or you can throw it directly into the trash. Or you can throw it into this, which is what you're using for trash. Okay, it can go anywhere, just, you're done with it. Okay, then I'm going to prepare my catheter. So I'm going to take it here, and don't just pull this off because the catheter will flop and touch against something that will make it non-sterile. So you want to feed it out. And you're done. And then we're going to lubricate that. So I'm going to bring it over here, lubricate 2 or 3 inches, bring it back in here, and leave it there. And the other thing now is that I need my syringe to inflate. So when I'm ready to inflate, it's already in place. So I'm going to take that off of that and put it in place. And if you look here, here is the port for your syringe. One of the things, if you go in and your patient has a catheter and someone didn't record the size, on these catheter kits it normally tells you. So this one says 16 French right here on here, and it says 10 milliliter balloon. Okay, so I'm going to go ahead and attach that, which I should have done just then. And so I'm going to put that in there, and it doesn't screw in, it just pushes in. All right, and that's ready to go. Now, I'm almost ready to start cleaning her, but I want this ready to go in place when I am ready to put it in her. So I can pick it up. Can I just grab it? No, outside is contaminated. I can touch it only inside. If I go like this, my arm's over my sterile field here, so I can't. I need to come like this, put 2 fingers in, get the other fingers out of the way, pick it up, bring it out, over, and down. Now, at this point, you can ask her to separate her heels just a little bit. If someone can help her separate her heels a little bit. Okay? So that this can come down further so you don't contaminate it while you're cleaning. Okay, now I'm ready to go with one dirty hand. Dirty hand, lift your gown out of the way. We're going to go ahead and clean now. You'll feel this. It may be a bit cold. There should be no pain with this. We're simply cleaning the area so that we don't create any infection. Now, these are not like a real human being in that with a real human being it's easy to keep them open. You slide your fingers between the labia majora and spread your fingers and it's there. With this, the only way you can get it to stay open, you have this little slit here, which is shorter than on a person. You go on either side and simply press down. Because this must stay open the entire time you're cleaning. If it closes, you need to start your cleaning from scratch. Okay? Take your first ball, labia majora on one side. Second, labia majora on the other side. And boy howdy, are we leaving cotton behind here.
I guess when the assessment was done, she wasn't cleaned.
She wasn't clean inside, that's for sure. Okay, labia minora on one side. No, there's just a lot of gel from before. Labia minora on the other side. And straight down over the meatus. And you're done. And this can even go in there. That's with the iodine. Yes, because the iodine's already on those cotton balls. Okay, now still keeping her open. We're ready for the catheter. I'm going to bring it closer. Grab the catheter. Still keeping her open. You should grab it about 3 inches back. On a person you can. You may not be able to get it in that far back on these mannequins because they can actually be tougher. So we're going to go to the meatus and we're going to start it in. Now, the main thing here is you need to keep moving your fingers back so your sterile glove never touches skin or your other glove. And I'm just going to keep pushing. And I've got urine. Can you see it? Okay. I've got urine. When you have urine, go another inch. So I'm going to push it in another inch. Then I'm going to back my fingers off. And now it doesn't need to go in anymore, so I don't need to worry about keeping this part sterile anymore. So I can release here, grab hold of it here, take this hand and inflate the balloon. When you inflate all the way, keep your fingers, keep the plunger down until you can release your syringe. Because if I've got here and I don't keep the plunger down, you see how the fluid comes right back out? And you want it in there, okay? And then you're done with that. Then you take a gentle tug here because you want to make sure that that balloon is right against the mouth of the meatus within the bladder, of the urethra within the bladder, so that it seals it off and you don't get leakage around it. So you give a gentle tug here. Don't just jank people, especially on guys. They really protest about that. Okay, and now I'm ready for my stat lock. You open it up. My hands are not very strong anymore.
Want me to open it for you?
Yeah, I think I'm going to have to have you. Thank you. That looks so easy. Okay. Do I care if this is sterile or not? No, it's on the outside. Okay. Now what you want to do is bring your catheter up and fit it into here, right at the bifurcation of the two ports. Do you see how it's sitting in there? There's a bigger side and a smaller side, and you simply close this. Then once you've closed that, you want to put it on their thigh, and don't please stick it actually on our mannequins, but all you do is you pull this, you hold it in place, you pull this, and stick that onto the skin. When you remove it, you use alcohol to remove it. Okay? You stick it in place. You always want to stick it in place, male or female, with some give between the meatus and it. And you can see that this pivots, so that as the patient moves, this goes with her. Okay? And then we're ready to remove this. So I'm going to take this. It doesn't matter if I stay sterile now. I'm going to lift this out and get the box out of the way. And then I'm going to hang the bag up. Now she is peeing like crazy and we don't want to lose that much. So I'm going to do something you would never do.
I'll do it after you.
Okay, well, it's going to all be down in the bag
That's
because
okay.
there's a lot.
I
Okay,
know.
so
Happens all the
the
time.
next thing you do is you're going to take this and you're going to hang the bag. Now, if you look, you want never, once the patient has this in, to lift this so that there's backflow into the bladder. Because once it's out, you don't want to put it back into the sterile bladder. Okay, so you're going to bring it over. You're going to open it up. Anytime you need to, like if you're changing the side of where you're hanging the bladder, you want to empty the tubing into the drainage bag first, so that as you lift it over the patient's legs, there's no drainage back into the bladder. You have the bag, you turn this, and you hang it. Now, if you look under the top rail, under the lower side of the top rail, on the underside of the frame of the bed, there's a little metal piece that comes down, and that's where you hang it.
It's on both sides of the bed.
On both sides of the bed. Can you see it there? There's a little hook that hangs down there. That's where you hang it. Never on the bed rail, never on the frame of the bed. Then you want to make sure that this has a straight shot down to the bag. So if you bring it up, it'll form a natural loop from the way it was in the box. You take, there isn't even one here.
It is. It's under your hand.
Oh, there it is, okay. Okay, so you have this piece here, move it up to where the loop is. You're going to take this across the tubing and hook it onto the bedding to help hold that in place. And then this has a downward slope all the way to the drainage bag. Okay? You don't want it to come down, make a big loop, and it has to come uphill to the drainage bag, because it won't. And then the patient will have urine start to back up in their bladder. All right? So that's all there is to hanging it. Now, suppose the doctor said, I want you to get a sterile specimen of urine when you put the Foley in and send it down to the lab. You have your specimen cup right there, and it's sterile, because it was in the sterile kit. But when you very first put it in, it goes down a sterile system, closed system, so there's no introduction of bacteria there, down to the bag, and all you do is, and you can do it with the bag hanging, and that's how you should do it, but I'm going to bring it up so you can see. All you do to get your sample then, right after you put it in, the very first bag that's hitting the first urine that's hitting the bag, you can take this loose, bring it down, bring your specimen cup, unclamp this long enough to get your specimen, reclamp this, wipe this off with an alcohol swab, and put it back in. Okay? That's the only time you can do that is when you first put it in. That's the only time. Okay? If it's been in even 15 or 20 minutes, and the doctor says, oh, I want you to get a specimen, you can't do that anymore. Then where you have to go to get your specimen is right up here. You see this blue port here? You're going to take a normal syringe, a Lure-Lock syringe, which means you can screw it in place. You're going to put this in place. You're going to draw 10 cc's, put it in your specimen cup, another 10, put it in your specimen cup. 20 to 30 milliliters is all you need. So you're going to wipe this off first, draw your urine, put it in there, and there's your specimen. But this is where it has to come from if the thing's been in for a little. Now, what if you have no urine here? What you do is you will come down a little to where there's maybe about 10 milliliters worth of urine here. You're going to clamp the tubing, and you're going to bring this up. So you're going to clamp the tubing and use this to hold the clamp until enough urine accumulates in there to make your draw. Okay? And then don't forget to unclamp it. But that way you can get a sterile sample of urine, or as sterile as it is, coming directly from the bladder. Okay? Everybody with me? Mm-hmm. Okay, now you're going to remove the thing. In removing it, drain everything into the bag, because you may be keeping track of how much output there has been. So drain everything into the bag, take your syringe, remove it from the stat lock, and you'll take the stat lock off afterwards. Okay. So this is now still on the leg. And come into your port for the balloon, withdraw. You know both from here and from your previous nurse's report who put it in how much is in there. If it's been in a few days, there may be a milliliter or so less, because some of it does go through the balloon into the bladder. But this is sterile water that's going in. So empty it out, pull a little to make sure you've got it. And then all you do, and again, you're going to want something underneath them, whether it's a towel, a chucks, something in case there's any dribbling. And simply pull it up. Okay? Now I want to show you something. Yeah. Hey, lady, you're a little bit cottony here. Okay. I want to show you something as to why you push it in that extra inch. When you see where the holes are at the tip of this? Can you see the holes? Okay. The minute you get in and it's that far into the bladder, you start getting urine. But the balloon's past that. If you start inflating immediately, you're inflating this within the urethra. Very painful for the patient. So you push it in that extra inch and then inflate your balloon. Okay? And when you tug that down and it's against the mouth of the urethra inside the bladder, that's where you want it, and that's what holds it in place. That makes it an indwelling urinary catheter. Okay? Okay. Now we're going to go over next door and see what the differences are with the male.